Simple screenings may be all it takes to save your life. Dr. Harani Maserati from Advent Health is here to explain how important these screenings are to detecting diseases such as colorectal cancer this morning. That's what we're focusing on. So good to see you, doctor. Thank you for being here.
Thank you for having me.
This is one of those cancers, and certainly we are going to talk about colonoscopies as well, where I think sometimes it's a little icky for people. They kind of push it off. They don't want to talk about it. How important, though, are those screenings, doctor?
It's of the utmost importance. Colorectal cancer is the third most cancer in the United States. It is completely preventable. We do realize as physicians that it's something people don't want to talk about, but this is my passion, and this is something that I believe is completely preventable as long as you follow guidelines.
Why is it your passion? Is it because there is something that can be done about it? I mean, it's one of those few cancers that we can catch early if it's screened, correct?
Absolutely. So most cancers in the colon and rectum come from polyps, which you don't know you have. They're asymptomatic. So colorectal cancer can not only be prevented if you undergo screening, but early cancers can potentially be cured with less invasive options.
That is great news, and it continues to be great news. But obviously, there's still, if it's still the third, kind of cause of cancers, we still need to get the word out about this. So who needs to be getting these screenings? I know a lot of times things change over the years too. There's maybe some misconceptions out there. What do you want people to know this morning?
The most important thing is that for average risk individuals, so if you feel well and you otherwise are healthy,
and don't know of any family history?
No family history, which I'll talk about in a second, but you should get screened at the age of 45.
So 45, both men and women?
Men and women at the age of 45.
Okay.
Now, this is a recent change. It used to be 50. The American Cancer Society just dropped the recommendations to 45. So everyone should get screened at the earliest at 45, and I still think that's still too old.
Oh, really? So you would think even if you can get in there sooner if possible?
Absolutely. This is where it becomes a little bit tricky from an insurance standpoint, but most societies do recommend that you get screened at 45.
Okay. Let's talk about now family history. And if there is somebody in your family that has dealt with this, what say you, doctor?
So if someone in your family, a first-degree relative, such as your mom, father, or a brother or sister has had polyps or colorectal cancer, you should get screened 10 years before the age of their diagnosis.
Okay, so give me an example then.
For example, let's say that your mother had colon cancer at the age of 45 or a colon polyp on her screening at age 45.
Okay.
You should get a colonoscopy at the age of 35.
Okay. Now, what about grandparents? Like if it skips a generation or anything like that?
So if two second-degree relatives, so a grandparent, aunt, uncle, or cousin has colorectal cancer or a polyp, so if two of those individuals have any of these polyps or cancers, you should get screened 10 years prior to their diagnosis.
And then how often should we be getting screened?
It depends. So if you have a polyp or if you have a family history of polyps, at the very minimum, depending on the type of polyp, you should get screened every 5 years.
All right, now let's actually talk about the screening, because I think this is when people go, oh no, I don't want to do it. It has gotten easier from what I understand over the years, correct? Kind of the prep work that goes into it.
Absolutely. So there are multiple ways to get screened. There are stool tests that test for DNA or blood.
And that can actually be done at home?
Those can be done at home. Now, that is technically part of societal guidelines as an adequate way to be screened. Now, if that comes back as positive, your provider or your physician will recommend a colonoscopy at that point. The benefit of the colonoscopy is it's diagnostic and potentially therapeutic, where the stool studies, if they're positive, it doesn't necessarily mean that you don't have anything. So I recommend that if you're going to get screened, you choose a colonoscopy.
Okay, and then again, put down any fears that people have of that prep work. And
Yep, the prep is really not that bad. I did my colonoscopy a few years ago. The worst part is the day prior. Back in the day, patients had to drink big gallons of liquid. Nowadays, you can drink much smaller amounts. Now, it does have the same effect, so I always tell my patients, make sure you're by your own toilet, but really, it's about risk and benefit, and there's no doubt that the benefit of doing a colonoscopy, it definitely outweighs the drawbacks.
Well, as we get ready to wrap up here, did we miss anything? What's your take home for people watching this morning?
The take home is get your colonoscopy. It's really not that bad. For the most part, you're asleep for it. Colon cancer is completely preventable no matter how well you feel. it's common. Younger and younger folks are getting colorectal cancer. I've seen 29-year-olds who've had colorectal cancer without a family history, and I think that within the next 30 years or more, the recommended screening age is going to be dropped to lower and lower ages. So, at the very minimum, get your colonoscopy at the age of 45.
Peace of mind is priceless, right?
Absolutely.
You know, so no news is good news. Doctor, thank you so much for your time this morning.
Welcome.
We really appreciate it. We love when Advent Health is here, and we always learn so much from you and your team. If you have any other further questions, you can check out their website right there, and certainly we will put it on our website as well.